Hey guys, welcome to Spirit Pig. This is the show that explores how to live a fulfilled life. I'm Duncan CJ, and today I'm talking to Dr. Penny Sartori. Now, Penny worked as a nurse for 21 years in a major British hospital, and 17 of those were in the intensive care unit, and she cared for many patients who were close to death. And during this time, Penny conducted a unique and extensive research into near-death experiences, or NDEs, of her patients. And in 2005, she was awarded a PhD for her research. She's the author of the international bestseller, The Wisdom of Near-Death Experiences, How Understanding NDEs Can Help Us Live More Fully. And her work has received worldwide attention and media coverage, and she speaks at conferences all around the globe. And it's even received the attention of His Royal Highness, Prince Charles. So it's amazing to have you here, Penny. Thank you so much.
Oh, thanks for asking me. It's great to be here.
Now, I know that I think you've been studying near-death experiences for, what is it 19 years now? Or?
Yeah, about 20 years now, yes.
20 years, okay, so there's probably not too many other people in the world with better to talk to. But what was it about, I think the evening you were working a night shift like years ago that actually started you on this journey? Could you basically just describe that evening and what kind of happened?
Yeah, well, I was looking after a man, and it was on a night shift, and he was dying. He knew he was dying. He'd been in intensive care for about 14 weeks, and we were doing everything that we could to keep him alive. And I can remember on this night shift in particular, I just adjusted the bed to put it flat to give him a wash and change his position. And the poor man was in so much pain, he nearly jumped out of bed in agony. And at that point, our eyes connected, and I looked into his eyes, and it felt as if I'd swapped places with him, and I could feel like what he was feeling and all the things going through his mind. And when it ended, I was really shocked, and I thought, oh my goodness, what am I doing to this man? He's at the end of his life. He's got no dignity. He's got having such a prolonged suffering death. And I couldn't stop thinking about that all night long. And I went home the following day, and I couldn't sleep because it had upset me so much. He was on my mind. And I phoned my colleagues just to find out how he was doing, and it was about mid-morning, say about 11 o'clock. And they said, oh, he died about 2 hours after you left. And after that, it was something that really made me realise that we don't understand death. We kind of push it to one side, and it's such a taboo subject. And so I started reading about death. And I came across near-death experiences, and I thought, goodness me, these people are saying that death is a wonderful experience, and their lives are changed after this experience. And I thought, is there anything in it? And it just really fascinated me. So I started reading more and more about near-death experiences. And I found that I became hooked on them, really. I became obsessed with them. And I think really this kind of skeptical side of myself said that they were just maybe some sort of hallucinations, because, during my nurse training, I'd never been taught about these experiences. And I'd always thought that they were just some sort of hallucinations. I'd never really heard of them, but I thought any sort of unusual experience must have been a hallucination. But the more I read about them, the more curious I became. And I thought, well, I'm working in the best place I can to research these further. So that's what I decided to do, undertake my own research study.
Well, I think, and one thing you mentioned there about like the skeptical side, like surely these are just hallucinations, but you actually like further down the line, you actually realise you can actually sort of differentiate between a near-death experience and a hallucination in terms of actually the memories and the things they talk about. Is that right?
Yeah, that's right. Now, in my research, that's what I did, you see. I wanted to see, was there any way I could compare these with hallucinations? And so I interviewed all of the patients who had been hallucinating as well. And so I documented 12 cases of hallucinations so I could compare these with the near-death experience. And what I found with the hallucinations is that when I investigated these in depth, I kind of interviewed the nurses who were looking after these patients at the time. I looked at their medical notes, and I realised that what these patients were telling me were things that had actually happened, things going on in the background. So they could hear staff conversation, they could feel the things that we were doing to them, and this was happening as their sedation was wearing off. And with a near-death experience, it wasn't attributable to things going on in the background when I investigated those. Now, when I followed up patients who'd been hallucinating, they could later rationalise that it had been a hallucination. They were often embarrassed by their behaviour. Some of them didn't remember it. And, they just said, oh, yeah, gosh, I'm really mortified I was hallucinating like that. But when I followed up the people who'd had the near-death experience, they were adamant that this is a real experience, And two of them in particular said, unless you've had this experience for yourself, there's no way you could possibly understand it. And so there were very significant differences between the two groups, really.
Would you say that? I mean, is there such thing as a sort of a typical near-death experience, or is every experience like completely different in nature, or is there some sort of consistency or like different themes coming up again and again?
Yeah, there are certain patterns. They may start off with perhaps an out-of-body experience and they look down on the emergency situation from above. Sometimes they go through a dark tunnel towards a light, or sometimes they just go through darkness into light. And then when they're in the light, it's usually something like a beautiful garden with lush green grass, vividly coloured flowers. They may meet their dead relatives, and they may meet a religious figure or a being of light. Sometimes this being of light could be associated with the person's culture. Sometimes they have a life review, and the life review is really fascinating.
I'm glad you mentioned this. This is something I wanted to ask you about because I found this fascinating.
Oh, it is. It really is, because that has such a profound impact on these people, It's because it's not just like rewatching all of their life. It's as if they relive it. And they can see it all the significant things, all of the insignificant things they'd forgotten about. And the interesting thing about the life review is that sometimes they can experience it from a third-person perspective. So if they've been unpleasant to someone, or they've hit someone or something like that, they can be in their shoes and feel like what it's like to be on the receiving end of that unpleasantness or that violence or things like that. And it gives them a totally different perspective then on their actions. And also as well, if they've been really nice to someone in ways that they hadn't really realised, they can feel like what it's like to be on the receiving end of that as well. And one example was one man said, this day I was walking through the back lanes from my house, and he said there was a man in the lane, and he said, I don't know what it was, but I just really wanted to smile, and I smiled at him, and that was it. But during his life review, that man that he'd smiled at had been profoundly, profoundly depressed. And he said seeing that man coming towards him and smiling at him had given him a different outlook, and it had raised his spirits a bit as well. So he said, even like the smallest gestures that we have do have an impact on people as well. So that is fascinating to me. Very often as well, these people, when they're having the near-death experience, it's a lovely experience and they want to stay there. All pain disappears. It's really comfortable. It's described as almost ecstatic and joyful and blissful. But sometimes very often the relatives say it's not your time, you have to go back. And, very often they don't want to go back. And so they're sent back into their body and they wake up and they just wonder what has happened. They know something profound has happened, but they very often don't understand what it is that's happened to them. And in fact, there are some cases where people have revived and been quite angry at being resuscitated.
So it almost takes away that sort of the big fear of like being scared about dying and stuff. Actually, a lot of the the feedback was actually no, this is actually something peaceful and nice. Yeah,
that's right. And it has so many different after effects. And the most profound after effect is the way they face death after that, Most people say that they have absolutely no fear of death at all. Now, this isn't to say that they want to die and that they're ready to die. They're not, They live life in a totally different way. But they say, when it's my time to die, I won't be afraid. I've experienced it once. I know what it's like, and it's a wonderful experience. And, there was one guy in my research, and he was so full of emotion and everything after his experience that he really wanted to go and tell all of the other patients not to be afraid of death. And when he was discharged to the rehabilitation hospital, he was talking to all of the other patients around him, and he really raised the spirit of the whole ward, And when he went home and I went to interview him in his home, he showed me all of the cards that he'd had from the other patients and their relatives saying, thank you for talking to my relative. You really helped him. So, it can be really motivating to help other people as well.
Amazing. And when you were saying about when when they often, one of the messages that comes through is that, you know, it's not your time. Could you share the story of Sally? Is it Sally?
Oh, yeah. Yeah, now this is really fascinating because Sally was an amateur athlete and she had a really horrific head injury. She had an accident, and during that time she was hospitalised. She was in the intensive care unit. She wasn't expected to survive. They thought that she was going to die. And the doctor had spoken to her husband and said, look, it's unlikely that she will survive, but in the rare event that she will, she's going to have to learn to walk again because her injuries are so extensive. And during the time she was unconscious, she remembers having this near-death experience where she had this presence with her all the time, and it was this voice, and this voice said to her, you have a choice. You can stay here or you can go back. But if you decide to go back, you will be stronger. Now, she doesn't remember making a conscious decision to go back to life. All she remembers is waking up, and she had these people around her who she didn't recognise. Now, she didn't know whether she was dead or alive at that point. And then she later realised that these people at her bedside were her family, and she didn't recognise them. So she had to learn to recognise her family again. And then she did continue to make a really good recovery. Now, the remarkable thing about Sally's case is that despite this horrific head injury, a month after she was discharged from hospital, she actually ran a 10-kilometre race. But further to that, she went on then to become an ultra-distance runner. And she's been in the Guinness Book of Records 3 times, and her greatest achievement is running across Australia from Sydney to Melbourne, which is 625 miles, and she did that in 8 days without any sleep. It's like incredible, you know, it's absolutely phenomenal. And, you know, she said the thing that kept her going was that she tunes into this voice. She can just close her eyes and that voice, she's in that place again. And she said, that's what kept me going. You will be stronger. And I knew I would be, and I knew I'd complete the race. And she did. Incredible.
I love that. And one of the, I mean, it's a bit slightly off topic, but one thing which kind of made me, I know it's quite funny how some of the sort of the side effects of some people who've had near-death experiences about electrical items and like, computers. And then there was when you were at the conference in Houston, could you basically just describe that?
Yeah, that's right. Now, some people get these changes in their electromagnetic fields and can't wear wristwatches afterwards, or electrical items malfunction. And I actually witnessed this because I was at this big conference in the MD Anderson Cancer Center in Houston, Texas. And this is an amazing place, really high-tech, everything there. And the beginning of the conference, it was all the scientific papers, people presenting about their research. And the last few days, it was people who'd had a near-death experience talking about the experience. And as soon as the people who'd had an experience got up on the stage, the lights were flickering and the microphones failed as well. They had to change the microphones. So I actually witnessed it firsthand as well.
So this is all, I mean, I'm sure, I mean, like, yeah, they don't necessarily know 100% the reason, but it's something in terms of their bodies, it's different, it's something alters or something.
We don't really know what it is, but the electromagnetic field is altered in some way after these experiences. Not with all people, but with quite a lot of them, really. And it can be quite disruptive in their life, you know. There's one guy I know, and he said every time he uses his credit card, he puts it into the machine, it won't work for him. So it can be really disruptive in ways like that.
I love all these sort of case studies because they really, they paint an amazing picture. Can I ask you one more? The patient 10.
Oh yeah, this is an amazing case, you know, and it is really quite unique because this guy was in my hospital research. At the time he was having his near-death experience, I was actually there looking after him. I didn't realise it until he regained consciousness. But it was one morning and we decided to sit him into the chair. He was making a very good recovery, but he was still ventilated. And when you sit patients in the chair, it's good for their muscle tone and good for their breathing. So as soon as we'd sat him in the chair, I noticed that his breathing pattern changed slightly. And then the alarm went off and it showed that his oxygen levels had dropped a little bit. So I give him some extra oxygen by squeezing it into his tracheostomy with a bag called an ambu bag. And that resolved the problem. But then shortly afterwards, his heart rate went into a very fast rhythm very briefly. and his blood pressure started to drop, and then he started to go grey and clammy. Now, all of these are signs of a possible cardiac arrest. So I quickly gathered my colleagues, who had quickly got him back into bed, by which time he was deeply unconscious. I was pressing my knuckles onto his sternum, which would usually you'd get a reaction. If you press a pen into the nail bed, that evokes a reaction. Nothing. He wasn't responding to any pain. He wasn't responding to us calling his name. He was completely unconscious. His heart was still beating, but he was deeply unconscious. Now, we called the doctor. The doctor came and reviewed, gave him some fluid for his blood pressure. The doctor went back to this emergency, and after about 10 minutes, again, this blood pressure started to drop again. So I went out to look for another doctor, and the consultant walked into the unit for the first time that day. So I said, quick, can you come and see my patient? So he quickly came, he examined him, he shone a pupil torch into his eyes to check that they were reacting, which they were. And then we sorted out his blood pressure, gave him more fluids. And once he was certain that the patient's condition had stabilised, the consultant went back to his office. In the meantime now, the patient started to flicker his eyelids and move his limbs, all signs of regaining neurological functioning. So we were happy that he was recovering. And then in the meantime, he dribbled from the side of his mouth, so I cleaned that. And what I'd done is I'd used a suction catheter and sucked up those secretions, and then put a pink lollipop into his mouth. And after about 4 hours, this man regained full consciousness, and he was really, really sort of animated. He wanted to tell us something. He couldn't talk because of the tracheostomy. So the physiotherapist now, because the ward round had approached his bed area, so there were several doctors, physios and nurses, and the physio got a letterboard, and he spelled out, "I died and I watched it all from above." And the consultant said, "Oh, you'd better tell Penny about that then." So when I interviewed him about this, he described being out of his body. But what is interesting is that what he reported was very accurate. He reported me cleaning his mouth, and in the way that it was cleaned. He reported and correctly identified the consultant as having examined him. And he also reported the physiotherapist looking very nervous, poking her head around the curtains. Now, all of these things are correct, and those things happened while he was deeply unconscious and his eyes were closed. So, how could he see those things? He was deeply unconscious at that time. But he also then said he went into a pink room, and in this pink room was his dead father, who was calling him, his dead mother-in-law, who he didn't know but recognised from photographs, and also there was a man, and he said, "Now, I don't know who this man was. It could have been Jesus, but it's not what I was expecting Jesus to look like, because his hair was scruffy and it was long and it needed a good combing." But he said his eyes were piercing, and I was drawn to look at his eyes as well. And he said, "I was so happy and I wanted to stay there because all my pain had gone and it was just so nice and peaceful. But this Jesus man said, 'No, you've got to go back. It's not your time.'" And as soon as he said that, he said he started it felt like he was floating backwards. And he said the image gradually faded before his eyes and he ended up back in his body. But he said as soon as he was back in his body, he was in immediate pain. And it was so bad that he wished that he was dead. But the interesting aspect of this case is the man has cerebral palsy. And so for 60 years of his life, because he was 60 when it happened, his right hand had been in a permanently contracted position like that. And he didn't have much use of it.
So for anyone who's listening just the audio only, so what, your wrist bent down, yeah?
Yeah, so his hand, as if his clenched fist sort of thing. And then after the experience, he misinterpreted one of my questions when I was interviewing him. And he said, "Oh yeah, look, I can open out my hand." And now he can open out his hand fully. At first, I didn't realise the significance of this. But then when I asked the doctor and the physio about this, they said, that shouldn't be possible. Physiologically, his tendons would be in a permanently contracted position. So to open out his hand, he would have to have an operation to release the tendons. Well, nothing like that was done. So that is something that we really don't understand. So I think it's really important, because if we could understand the mechanism behind this, other people who have got these similar ailments, maybe we could do something in ways that are non-invasive and not involving surgery. It could save the NHS millions in the long term,
And so, for example, if I'm at home, I'm listening to this, and all these things are just absolutely fascinating. But in the context of this show, like what can we learn about this from life? How does this translate into, I don't know, how we approach life, you know what I'm saying?
Yeah, well, that's one of the things I noticed with my research. I was so busy trying to find an explanation for these experiences, I found that I was overlooking the most important thing, and that is the message of the near-death experience. And when people are in this near-death state, they realize that we're all interconnected, and how, especially with the life review, how our actions impact on other people as well. And ultimately, our actions come back on ourselves. And so I think, the ultimate message of the near-death experience is treat others as you would like to be treated yourself. And if you think about it, that is the message that is at the heart of all of the wisdom traditions. And I think if we all lived by that message, how different our world would be. So I think, that for me has been the biggest message. But of course, there's things like contemplating our own mortality as well. Because when we start to think about our own life and that it's finite, we're only here for a set amount of time. We don't know when we're going to die or how we're going to die, but for certain we all are. And when we embrace that rather than be afraid of it, I think we can apply it to our lives. And what I found with my research, a lot of people say I'm morbid studying death, but I think when you start to learn about death, that's when you really start to learn about life. So I think, it can be very empowering for how we live our lives.
Yeah, I agree. And I found one thing which I heard you speak about previously, which was fascinating, was you talked about Darwin. And actually, basically, like, when we think Darwin, we immediately think sort of survival of the fittest. But you actually talked about some of his work, which actually overlooked aspect of a lot of Darwin's work. Can you maybe just describe that?
Yeah, again, Darwin says that we actually survived as a species because we have the ability to cooperate and the ability to love and empathize. And when you apply all these things in your life, I don't know whether you're aware of the work of Dr. David Hamilton, who's written a book called Why Kindness is Good for You, And all of these things really impact on our health as well. So when you're good to other people and nice to other people, not only is it's contributing towards survival of our species, it's also contributing to our own health as well.
Yeah, because with just if you just think survival of the fittest, it's much more sort of ego based, like every man for themselves,
Yeah.
And so it's actually interesting that Darwin actually discussed this other stuff. It's just not so well known. That's what really jumped out.
That's right, yeah, and it's fascinating to me when I found out about it. I watched there's a great DVD called I Am, and it's directed by Tom Shadyac, who did the Ace Ventura Pet Detective films. And it's a lovely, really great DVD, and there's a lot of wisdom in it. And again, they were mentioning about Darwin in that, and it made me think and read about his work. And of course, that big bit of it, we only hear about survival of the fittest, but a lot of it is about our ability to cooperate and love and empathize.
That's so cool. And final thing. You talk about consciousness and the brain, which in a way which is really fascinating. I hadn't actually heard of it described like that before. It was you talked about the brain as a filter. And what do you mean by the brain as a filter?
Right, okay. Well, one thing I've looked at with consciousness is that we don't understand what consciousness is, and we've always kind of taken it for granted that consciousness is produced by the brain, so that when the brain stops or the heart stops and we don't get enough oxygen to the brain, there's no brain function, so there's no consciousness. But with near-death studies, near-death experiences, what they're showing is that there's a heightened state of awareness in some people who have a near-death experience, and their brains are not functioning. So how can this be? So I think the most logical way of looking at it is to consider consciousness from a different perspective. So it makes far more sense to me to consider consciousness as being primary. So consciousness is around us all the time, but we're not aware of it because in some way our brain acts like a filter. We've got so much sensory input every day, so many thoughts per minute, that I think we're unaware of this consciousness that's around us. But there are times in our life when that filter action of the brain becomes relaxed. And rather than the brain creating an experience like the near-death experience, all it's doing is relaxing that filter action. And so this consciousness, this heightened state of awareness is allowed into our everyday experience. And that makes a far better explanation for near-death experiences to me. So I think, we really need to consider consciousness from a different perspective.
Almost like the floodgates are open just for a second, and it lets in what's actually the real, what's actually going on.
Yes, that's right.
That's fantastic. And how would you say? I think you've insinuated a few of those things already, but how would you say that this whole thing has kind of affected you personally? Because you've obviously, having all these interviews, talking to these people, you must have learned a huge amount, yourself. How has it changed the way that you approach and view life?
Oh gosh, it's completely changed me. Before I did my research, I wasn't kind of thinking of things like this even, and it's made me think differently. And I live my life in a totally different way. Now I realise there's one chance I've got to be in the body of Penny Sartori, and I want to make the most of that and do as much as I can with my life. And before, maybe I used to be quite well, I still am to an extent, but not as much as I was, but, a bit worried about what other people would think and things like this. But now I think, no, you've really got to go with this and do this, And I think the biggest thing for me is overcoming my fear of public speaking. I'm really, really shy. And to do any public speaking used to terrify me. But I feel so passionately about my research and the message that it brings that I've had to face my fear. And as a consequence, I've overcome it as well. So I think, it's really made me live my life, and it's led me to have an empowered life as well.
That's great. And finally, a couple of speed round questions to finish off. What does a fulfilled life mean to you?
Well, I think it's to live my life to the full, so that when I'm on my deathbed, I can look back and say, yeah, I did. I lived a fulfilled life, and I was really happy with everything that I did, and I've got no regrets about what I've done.
Awesome. And what is one thing all our listeners can do today that will have a massive positive effect on their lives?
I think gratitude for everything that we have. It makes such a difference. When I wake up in the morning, I just think, wow, thank you. I'm here today. I've got another day ahead of me. What lies ahead? And just gratitude for everything that I have in my life. Even simple little things that I take for granted. Being grateful gives me a different perspective as well.
Awesome. And are there any books or resources which have changed or had a big impact on you?
Yeah, there's quite a few, really. I think the work of Ernest Holmes, who wrote The Science of Mind, that's a really great book. I love that. Joel Goldsmith as well. These two are metaphysicians, and I love their work. And also something that I got into when I started doing my research, I read Conversations with God. And that was something that really gave me a completely different perspective, And I think it's got some great messages in it. So, yeah, amazing. I think those books are great for me.
Neil Donald Walsh, yeah?
Yes.
Fantastic. Yeah. I'll chuck those in the show notes. And we're gonna put your one, obviously, in the show notes. And last but not least, how can people stay in touch, find out more about you?
Yeah, I've got a website. It's www.drpennysartori.com. And I've got a blog as well, wordpress.com, Dr. Penny Sartori. So look me up on the internet, and I'm always, really keen to hear people's stories about their experiences. So please feel free to contact me. I do have quite a lot of emails at the moment, and it takes a long time to reply, but I will reply to you.
Fantastic. Penny, thank you so much for giving up your morning. I really, really appreciate it. It's been so fun talking to you.
And you too. Thanks.
Talk soon. Bye.
Thank you.